Hi, welcome to this week's episode of the Modern Patient Experience with your host, James Furbush. My guest this week is Terri Meier, Director of System Patient Revenue Cycle for UC San Diego Health. Terri, welcome to the show this week.
Oh, thank you for the invitation.
Oh my gosh, no, it's my pleasure. Really excited to have you on. I'd love to just start, if you give our listeners just a quick overview of, your role at UC San Diego Health and your background, which is, really impressive with you worked at Stanford, OHSU, Portland, Oregon. Love to just hear kind of what you're up to right now at UC San Diego Health and a little bit about, for those who don't know, San Diego Health as an org as well.
Yeah, sure. So I'm Terri Meier, Assistant Director of Patient Revenue Cycle here at UC San Diego Health. My role is, once the balance becomes due from the patient, I have the customer service, self-pay billing, financial assistance part of the revenue cycle. So we are the face of the patient financial experience, and UC San Diego takes that pretty seriously. I started here about 4 years ago, came from Stanford Health, where I was there for almost 5 years. And then 12 years prior, I was at Oregon Health and Science University. And then before that, I was a hospital consultant for about 18 years. So I've been in healthcare for a little bit over 40 years now. So started right out of high school. So it has been my career forever, actually. A little bit about San Diego is we're the only academic medical center in San Diego, and we're one of two level 1 adult trauma centers. So I think we play a big role in San Diego healthcare from that perspective. We have about 17,000 employees, 1,700 physicians, probably over $2 billion in net patient revenue. So quite big, quite large.
That's very, very, very large. That's so great. I love that you are just so focused on sort of that patient financial experience, because I feel like it's been changing a lot, right? With technology changes and sort of patient expectations, get into that. But then certainly just patients in general, what they owe, right? Like high deductible plans and them being a large source of revenue for a system. I'd love to hear, how are you seeing sort of those changes in the last, are they accelerating in the last couple of years? I mean, what's that been like for you at UC San Diego?
Yeah, I think it has. I know I was recruited down here from Stanford for the sole purpose of building their single billing office. So I think it was a project that they had been talking about for some time. I think the clinical care being, as excellent as it is, I think the billing experience for the patients here was a little lacking. I mean, again, before I came there, hospital billing, customer service was outsourced to a third party. And then their physician billing, they had, a small customer service department in-house. So the patient got multiple bills. They had to call multiple phone numbers to make multiple payment plans or to ask questions about their bills. So I think that was the impetus for San Diego to take such a strategic effort into the patient financial experience. So when I came here in 2016, we are an Epic shop. Epic has the single billing office module. So that was actually the reason why I came, was the opportunity to create a department from scratch. So there was no infrastructure. There was no technology. It was just come here and build it and hire the team, bring it all back in-house and see what we can do with it. And San Diego really was interested in making the billing or the patient financial experience, a differentiating factor, so much so that they allowed me to create, the customer service professional job description. And we are at the, the higher end of the revenue cycle jobs here at UC San Diego Health. So it was a career path, someplace to like a destination job. It was what you would aspire to be instead of where you would start out. And then as soon as a billing job would open up, you take the billing job. So it's, from a salary perspective, it's the highest paid revenue cycle position here at UCSD. But that salary comes with a higher expectation as to the type of individual that we have in these positions. I was able to hire employees that were knowledge workers, not so much just the average, customer service type employee. So we really put an emphasis on having knowledgeable people answering that phone so it can take care of that patient. Because with healthcare, as you said, being so complex, the answer to some of the questions are pretty complex. And then breaking, that industry, stuff down into words that, an average patient is going to understand. And understand so much so that they feel, okay, I got the answer to my question and they pay their bill is a whole different exercise. So that's what I kind of walked into when I came here to UCSD.
That's incredible. I feel like I have so many follow-up questions to unpack, but let's start because one of the reasons I was excited to have you on is for that very reason, like the premium that you place on employee education and empowering customer service, which, typically, to your point, they're typically thought of as the bottom of the rung, but you have sort of flipped that. And so I'd love to just go into the more specifics. So what was the impetus, for you sort of bringing that strategy and sort of thoughtfulness to that role at UC San Diego?
Well, I mean, again, to your point, I think the patient financial experience is really becoming that differentiating factor for, some organizations, especially with price transparency, all the regs around that. I mean, we're in California, so we've got, we've had that no surprise bill, AB 72, for a while. And patients, they go and they sign up for their insurance at their employer. And I think they mainly look at how much their premium is going to be and not how the insurance works. That's where we come in.
I would say just based on my own experience, well, I've become a little bit more knowledgeable, but I'd say 9 out of 10 people, when they find out, at least like I work in healthcare, have some minimal knowledge of like, they'll eat like what health insurance should I pick? When they do like open enrollment, because they do I'd say 9 out of 10 people do like, what's my monthly out of pocket without actually looking at what they're getting for that insurance, how that would actually impact them if they went to an emergency room or went to a out-of-pocket hospital. So are you seeing more like call volume increase? Like I'm like for customer service reps, I mean, has it just been a lot more for them to sort of take in and have to sort of navigate on behalf of the patients?
Well, in the end, we're a single billing office. So we are taking care of the patient holistically here at UC San Diego. So when I came, both the HP and the PB side, their talk time was about 4 minutes. And I think now, treating that patient holistically, our talk time is averaging 6.5 minutes. So it ticked up quite a bit. I just got this 2021 market survey from Customer Contact Weekly. And one of the things that stood out to me is it said of the potential reasons to call for support in 2021, none is more significant than complexity. Customers still believe voice interactions are their best option to handling complex matters. So we put some real, effort into building our self-service, our technology, but that's where I knew I needed to put that same level of effort into training and educating those agents that were going to be answering that phone, because those questions are the complex ones. Those are the questions that they can't get by going on to their, My Chart portal and, trying to pay their bill or set up a payment plan. We've got, some of that stuff now. It's just about industry standard. Everybody, needs to have propensity to pay. Everybody needs to, have some tailored payment plans, know your patients a little better. So you can, develop that self-service, for them, just for them. Then reserve your agents for those more complex discussions. How does my insurance work? And now with price transparency, patients don't understand that, our CDM price, they want us to post the CDM, but I don't think they understand, what that means. It's just our CDM price. It's not what they end up getting billed, because that's depending on our contract with their insurance company. Then again, if they have one of those high deductible health plans, because our prices are what they are here in San Diego, it can invoke their entire deductible just for that one service to the emergency room. I think, that's where we're getting a lot of our, complex calls, is explaining how that works.
Yeah. Oh, so what, those sort of complex calls, I love that you have done an SBO, you did an OHSU, Stanford, and now San Diego. Can you talk about sort of the importance of sort of moving to sort of an SBO if you're like a hospital based system with physician groups? Because especially as it relates to sort of that patient financial experience. I mean, you've obviously done that now and believe in that model. Yeah. So what does that mean, for the patients and their experience? Because that's sort of one of those changes that, I mean, patients don't necessarily see it, but they probably feel it, you
Yeah.
know?
Yeah, they definitely feel it because, before, like I said, they received two bills. They had two customer service numbers to call. They had to make two different payment plans. So with the single billing office now, it's single point of contact for the patient. They get a single bill for services, both the hospital and the professional services on a single bill. We can create a single payment plan for them. They can apply for financial assistance for their entire visit, not just the hospital, and then have to go and apply for the same thing at the physician. So it brings all of that together. So we're like a one-stop shop, and that's where, the education of my team comes in to leverage the tools that we have to know the patient. I think our thing is we want to know them, show them, and coordinate for them. Because I think that's the level of customer service that they're expecting these days, is for us to really, know them and show them and guide them through the whole billing and collection process, because it is very complex. So we do a lot of education. My team is CRCR certified through HFMA. We do a lot of infrastructure in place. I've got a education committee about that. I have team members volunteer for, so we can keep up with what's happening in the external environment, teach and train. So our customer service number is out there. Patient really doesn't know. It's just billing customer service. They just say customer service, and then they call us and ask us all these questions. So not necessarily if it's not what we handle, but if we know the right place to get the patient to get their question answered, that's just as good. We're still the hero there.
No, and to your point, like the patient, they don't know any better. No, I don't want to say they don't know any better. It's not that it, but like if a patient, they just want their problem solved,
Yeah.
whether it's through you guys and feel like someone is helping them. That's incredible. So what sort of goes into sort of that move to sort of move to an SBO? I mean, can you sort of just walk through, like, let's say there's another health system out there, revenue cycle team, and they're like, we should do an SBO.
I mean, the biggest complexity there is I think, is with the physician group, and it depends on the funds flow model with the physician group. That really helps the conversation. Here at UC, our funds flow model was our physicians are paid their work RVU. We take the risk for billing and collection. We have some departments in the School of Medicine that are, just their revenue is their revenue. And I think that was one of the biggest conversations was with physicians. What does that mean for me? Because hospital bills are larger. You're going to work the larger accounts first, and you're never going to work my accounts. But so that was their biggest question. When a patient pays their bill, when you're creating the single billing office, you have to have a posting methodology. So we chose, first in, first out, because we want to, you have to do the right thing for your aging, your AR days, and, your cost to collect and bad debt and things like that. So we chose first in, first out. But if the data service is the same for the hospital and the physician, we agreed that the funds would be posted to the physician first and then the hospital. So it helped in the conversation with the physicians. I think they were pleased to have, again, that single point of contact for their patients. We are just as much customer service internally as we are externally. So, I mean, we have a lot on our shoulders. And I don't know. Yeah, I do the customer service for UC Riverside too. So it's just not UCSD. So it's UC Riverside as well. Yeah.
Yeah. No one wants angry physicians.
Yeah.
Are going to get them, I would think.
Yeah. If the patient pays the balance in full, then, everybody gets paid. But if the payment is less than what the current balance is due, then it follows that posting methodology.
Okay. And so that's interesting. So you guys made that decision to get physician buy-in.
Yes.
To get them to sort of want to move to this model. But now going forward, I mean, are you guys a gold, or do you have metrics around sort of collecting
Yes.
for the, because I would think with high deductible plans, you want to try to collect as much as possible or not send stuff
Yeah.
to collections and things like that. Like,
Yeah, I am pulling up. We are a big, I mean, again, I came from Stanford. So, I brought over my lean infrastructure. So my team, we have a huddle every morning from at 8:10 in the morning. So we go over our stats, look at our calls from the previous day. We look at our goals. And then from a quality perspective, again, we are an Epic shop. So we participate in the Epic Pulse. So our days in AR, our self-pay days in AR for the hospital is 2.2, and our days in AR for the physicians is 2.5. So in Epic speak, we've got a bronze medal on the hospital days and a silver medal on the physician. From a bad debt perspective on the hospital, we only send 0.4% to bad debt, and
nice.
on the physician, we only send 0.5% to bad debt. So on the hospital side, we're a silver medal in bad debt. And on the physician side, we're a bronze. But again, some of those things that I mentioned before are pretty, almost industry standard now in order to accomplish some of this stuff. We, partner with a third party, and we scrub out our deceased, we scrub out our bankruptcy, we do presumptive charity. So again, the things that we're sending to bad debt are really those patients that probably have the ability to pay it that aren't. And then from a call center metrics, this is my October stats. My call wait time, so the amount of time we have patients on the phone waiting for one of my agents to answer is 7 seconds. My abandonment rate is 0.4%. So my customer service level is 99.6. And then our cash collections for October were 148.6% of goal.
That's amazing.
Yeah.
What do you attribute to that success?
I think a lot, I think a lot of it is the single billing office, that structure. Our patient statement is extremely simple. It just tells them, what you had done, what the balance is, why you owe the balance, and here's how you pay the balance. And we've opened up, omni channels, for our patients to, we've made it easy for them to pay. We've got our patient portal that they can pay and communicate to us through in-basket messaging. You don't necessarily have to have a MyChart login to pay. We've got the pay as guest. And then we've got an email address. So you can call, you can in-basket message, you can email us. So I think we've opened up all the lines of communication. And then again, I think a lot of it is that agent on the other end of the phone that can explain that very complex question in, satisfactorily. So then that patient is willing to pay that balance. I think that speaks a lot because, once we opened up all the the self-service, a lot of our volume has gone over, to self-service. And it really is those complex calls that are coming into our call center.
That's incredible. So for you, thinking about, as you're heading into 2022, what are your sort of biggest challenges sort of related to the patient financial experience? It sounds like you guys have done a ton of great work, but what's sort of top of mind for you that you're still kind of looking to solve or improve, or what's kind of the back of your head that, you still want to sort of fix and solve for?
Yeah, I think it's actually, again, we need to get that infrastructure in for the coming regulations to be that resource to the patient. But I want to build on our, we've got a voice of the patient, program for the most part. My agents, the root cause, the reasons why patients have to call us in Epic through an activity code. And then I'm able to run, analytics on that and then provide some of those feedback loops to some of the departments where, that revenue cycle conversation is broken. But I think it's being more proactive. I know we are currently working with our GI partners. I think one of the big questions, with the whole ACA and the whole preventative, it's really complicated because, it's different based on what insurance you have. And certain things are covered and certain things are not. And one of the big ones is colonoscopies, so what's considered diagnostic and what's considered preventative. We do a really good job with the clinical. We send them these little vignettes in their email to watch so they can know how to prepare for the colonoscopy. And I think we're trying to partner with that department to, as part of that vignette, tell them, what to expect from the billing process. So, be more proactive on what setting that expectation, because then when it happens, the patient doesn't have a need to question it because we already told them that it was happening before they received the service. So I think more proactive communication, again, taking that voice of the patient to the next level, because I think customer service, part of the interaction is, as you said, it's becoming more critical to success. I think, all clinical care being equal, and even in other, aspects of even retail, if you can get the same product somewhere, you're going to go where you got the best experience with that from a customer perspective. So that's what we're trying to build is, again, to be that trusted, resource for that patient.
Oh, that's awesome. This has been amazing. I feel like we need to have part 2 to this conversation and have you back on, real quick, for you, I'd love to just kind of hear real quick, where do you go for inspiration or what do you do to sort of recharge your batteries? It sounds like you've got, work is busy. You've got a lot going on, but I'm always curious for, other professionals, like what do you do to recharge your batteries or find new inspiration to bring into your professional life?
Yeah, sure. I work here at San Diego. I actually live in Portland, Oregon. So I get to go home on the weekends and, time with my family. And, again, having that split, you really decide what you're going to do in that time you spend home, because you only know it's going to be a couple of days. So, and I got 2 grandkids, so, they keep me busy. And I'm associated with a lot of, external HMA and other organizations where, just hearing other organizations' approach to these things really, inspires you as well. Because, I just have that service mentality, I guess, that, I just want to make a difference. And I think that's what I come to work with every day in my head is, how do I spend my time best to make a difference today?
No, that's incredible. Terri, well, thank you so much for joining the show. This has been amazing. I'm going to badger you for part 2 because I feel like I've got a lot of follow-up questions. We'll just have to get it maybe in next year at some point. But this has been amazing. Thank you so much. And I love the work that you're doing at UC San Diego Health. It's inspiring. So thank you.
Oh, thank you. Thank you for having me. Look forward to talking to you again.
All right. Take care, Terri.
Okay, you too.